Hi, everyone. Thank you for joining us. This is our provider call for Wednesday, the 16th. And thank you for joining us. We will go ahead and get started if that's okay with everyone. My name is Rais Vohra. I'm the Interim Health Officer for the Department of Public Health. And we will be recording this session and hopefully getting it archived, podcasted, remixed, etc., in collaboration with the Fresno Medical Society. So just to give you a heads up that we are recording. I'll be sharing my screen for just a couple of items, but it's totally not a problem if you're at a place where you can't see the screen, because we will just walk through what we're talking about. So we'll just go ahead and start. Not a lot to present. In terms of our numbers, our overall trends are looking pretty good as of the last week. The number of cases is 27,232. The number of deaths is 337. Hospitalized cases yesterday were 118, and ICU cases yesterday were 33. I'll try to recheck that and give you a better update. The state is now doing this thing called the Blueprint for Reopening, or something like that, Blueprint for a Safer Economy. And they have color-coded where each county is. And we're still in the purple, meaning widespread community transmission. However, our case rates are falling, and we feel like we're heading into the red if this trend continues. So as of yesterday, the state announced that the case rate for Fresno County was 7.5 cases per 100,000 people. That is just a hair above the cutoff for going into the next color tier, which is red. So to go from purple to red, we need to be under 7 cases, and we're at 7.5 cases. They also look at a metric called positivity, which is basically the number of positive cases divided by the number of overall testing being done. And our positivity rate is 6.8%, which is less than 8%, which is what's required to go into the red colored tier. So we're meeting one of the metrics to go into red, and we're just a hair above on the other metric to go into red. So we're still technically in purple. However, it's a very light purple, if you think about it that way, and we really hope that this trend continues, which will allow us to go into the red tier. Now, it's a little unclear exactly what happens and when, but basically if a county is in the red metrics for 2 weeks, then it can go ahead and get into that tier called the red tier. So it won't be next week at the earliest. It'll be 2 weeks from next week. If by next week we meet the red metrics. That really doesn't change our clinical practices, I don't think, but it does permit some sectors, such as restaurants, et cetera, to open gradually and with safe practices. For example, restaurants can open up to 25% capacity. Other things can open up just depending on what the percentage allowed by the state is for that color tier. So that's kind of why this color tier matters so much. And there's a lot of, I think, suspense and anxiety related to when we're going to switch from purple to red. And we're watching these metrics very closely. But that's how the state wants to do it. They really want to, I think, inculcate everyone to understand that this is a very slow, gradual reopening. It's not going to be that we flip a light switch and reopen everything all at once, the way that possibly was done earlier this summer and spring. They really want everyone to understand that they want to go very slow with the reopening, and they're really going to make everyone wait a couple of weeks even after we switch into the red zone in order to do some of these sector reopenings. But, you know, everything's looking good. If people just continue to do everything that they're doing right now, I think we'll be in good shape to reopen. We don't have the statistics back from Labor Day. So that is the one hiccup is, you know, if there were a lot of gatherings and meetings and transmissions over Labor Day weekend, then that could possibly put us back. But we're keeping our fingers crossed that we won't see a huge uptick as a result of that Labor Day holiday. And in the meantime, everything is looking really good with our numbers. So we're reassured by that. At the same time, some of our staff, including Dave Palmaville, have been very heavily deployed with the wildfire response and organization. There's a lot of firefighting teams, and even some physicians from the Emergency Medical Services Authority that are helping out in the mountains and foothills. So there's a base camp set up there, and they're really managing that response, which at this point includes thousands of people. So some of our staff are being called upon to help get that organized, and we stand ready to help support any sort of pandemic response that's needed, including if there's an outbreak or testing that needs to be done among all those first responders. Then we'll definitely help out with that. So that's kind of where we're at. The testing, I think, is also getting better. One kind of newer testing modality that has come online, which I'm very thrilled about, is the UCSF Fresno team, and their COVID equity project has been stood up for the last couple of weeks now. Dr. Kenny Bond and Dr. Stuti Kandawal are supporting that, and they have a whole team of people. They have a static site, and they also have some mobile sites. The static site is near downtown Fresno, and it's welcoming patients to test for COVID right now, and they don't have a wait, and they don't require any pre-registration, and they don't require any insurance documentation or anything like that. So it's actually a very convenient way to get testing done. If you have patients or if you yourself have staff that need to get tested, please check out the UCSF Fresno COVID Equity Project. There's also the other stuff that we've been providing through the county, through the Optum Serve sites, through the Verily sites. All of those are actually things that you can see on our Fresno County website. If you look under Find a Testing Site tab, then you'll be able to see that. The fire smoke continues to be a hazard. It's really impeding a lot of daily activities, and we are messaging as much as we can to let people know that this is something to be mindful of. And some of you in your clinical practices may be seeing more smoke-related complaints or exacerbations. We're also planning influenza clinics. We have over a dozen clinics planned, including the first one is tomorrow. And we'll try to find the information for that. I think if Sim is listening in, maybe he can share that in the chat box. But we will be doing influenza clinics really for the next few weeks, including a mass vaccination clinic on October 3rd in West Fresno. We would love to have some help. So if you'd like to volunteer to provide vaccinations or just see how it's done, so you could possibly organize one on your own, we'd be more than welcome. We would more than welcome anyone who wants to either help or observe what these clinics look like. We're also having some good communication with the Big Fresno Fair. So the fairgrounds is actually, it's a very interesting place. It's not something that I knew a lot about before I took this job, but the Big Fresno Fairgrounds is currently hosting animals that have been rescued from the fires. So they have livestock, horses, goats, pigs, bunnies, lots of bunnies. And I think they're going to get some cats and dogs as well. So they're staying busy right now with just the animal rescue operations as a result of these wildfires. But at the same time, they've been planning kind of a drive-through Big Fresno Fair, maybe a Big Fresno Fair Light, which will be done hopefully very safely. It will be mostly drive-through where people can go get food, etc., while staying in their cars. But at the same time, we also want to offer influenza vaccinations and COVID testing for those who are interested, and also an opportunity for people to donate blood. So we really hope that this Big Fresno Fair this year, it will be the Big Fresno Health Fair. And we definitely want to have help if you're interested in helping out with any of those activities. So please think about that. That's October 10th. And that whole week will be the Big Fresno Fair. And we will be organizing a lot of the health activities to help support that fair, while at the same time they're organizing on their end all of the other activities that can go on, provided that they mandate that people stay in their cars. So it should be very interesting. We're all kind of learning together, trying to do this. We're spending a lot of time right now working with the schools. We had a very productive discussion with our school superintendents today, and we are at a point with our epidemiological numbers where we can actually grant waivers to open the elementary schools. That requires a waiver application where the school's leadership really has to, I think, have some consultations and buy-in from the teachers, the school boards, the parents, obviously, and the school staff, and create an opening plan that's acceptable with health and safety all accounted for. And at the same time, they also need to create plans for managing outbreaks and cases if they occur. So there is some medical, there's quite a lot of medical oversight that they need to think through, and we've been kind of helping with that piece of it. But there are school districts that are intending to apply for waivers to let the elementary school kids come back. And that could be as early as a couple of weeks from now. So you'll be hearing more about that, I'm sure. But what that means is, if you are working with schools in any capacity, then you may be advising. I would say, please relay any questions that you want to us, so that you can get good information about what that's going to look like. At the same time that's going on, we're also working on a draft of the order for our medical providers to offer COVID testing. That's deliberate. We feel like as we're reopening these sectors, including schools and other sectors, that we are going to have increased cases. I mean, that's exactly what we experienced earlier this spring and summer. Provided that everyone does it safely, we hopefully won't have the surge that we had. But if there are increased numbers of cases, that will drive increased testing that will be necessary to do. And we're really hoping that everything comes together in a way that people can support each other, so that our medical providers can support all of the sectors that are open, and all of the sectors can open safely, because there is a lot of community concern about outbreaks, and they can feel a little bit more comfortable about opening, knowing that testing is available, that there's providers that are ready to help support outbreak management, et cetera. So we've been very much in conversation with many of you, and also with the schools and other sectors about how to make that happen. And we're looking forward to this phase, which hopefully will allow all of us to be doing more activities, but do them in a way that's more safe. Let me just share what the latest draft of that, let me just share a couple of documents with you, because I'd really like to get some feedback about these orders that we're writing, because I don't want to surprise anyone, and I really want to make sure that we've thought through what we're doing here. And I'd love to get feedback from everyone on this call who has an interest in speaking up, just to make sure that we've heard from everyone. The Fresno County Testing Sites tab has been shared in the chat box, and you can throw some questions in the chat box too if you want. Let me share. Any questions so far? I'm going to go ahead and share my screen. Like I said, don't worry if you're not able to see the screen that I'm sharing. So the first thing that I'm going to show you is basically something that the schools are looking at right now. This will become, I think, ready for public consumption fairly quickly. But this is basically the waiver application that schools have to fill out. And this basically just says that, that they've attested, that they've confirmed reopening plans have been shared with all of the stakeholders. And then basically the health screenings will look like this. They have to have a plan for how kids enter and staff enter and exit schools. They have to have a plan for face coverings, distancing all of the pupils and the teachers, health screenings for staff. They have to have a team that can take charge of the contact tracing and the medical investigation. And they also have to have some sort of plan to isolate symptomatic individuals. Now, obviously, if somebody's symptomatic at the start of the school day, they're going to ask them to go home right away. But if somebody becomes symptomatic in the middle of a school day, then they should have a plan in place to keep that person isolated so that they're not transmitting germs to other students or teachers. The last thing that is in here is they basically need to have a contact person, like a school nurse or some other medical professional, who can help us be the lead for medical investigations and contact tracing. So that has to be somebody that's based at the school or affiliated with the school. And they also have to have someone that can swab people on site, or somewhere like a healthcare clinic or a provider who will provide testing for COVID-19. And that's because if there is some outbreak, meaning that, you know, a lot of these barriers that we've got in place all fail at the same time, then you could have a school outbreak. I mean, that's happening already in other communities and states. But if that happens, that means we would have to get a large group of people tested all at once. If that happens in multiple places all over the county, there's no way that the public health department can take care of all of those outbreaks in a timely fashion. So we really need everyone to be doing this on site. So we want to train up the school nursing personnel or other medical personnel, or if the school wants to work with a primary care clinic or a provider who can provide testing, then we want that information on file so we can quickly find that provider and say, you know what, we need to have 10 people tested. Can we send them to you so that you can set that up for us? So I just wanted to share that in case you hear that conversation or in case you get approached. Really, please give us feedback about how that plays out. Honestly, you know, the principle that's guiding all of this is transparency and planning. And we really want to be transparent so that everyone in the community understands how each school is going to approach testing, contact tracing, medical investigations. We really want to arm everyone with the skills and resources to be able to do this. All of you who've done swabbing or have been participating in COVID investigations, you know, I think you understand it, but this is obviously a very foreign concept to some of the educational professionals. But it's time that they understood exactly what's required, because if they are going to bring kids back to school, they need to understand what the testing looks like and how to get that done. I don't think it's hard to stick a Q-tip in somebody's nose. I really think that a school nurse can do it. And I'm more than happy to write the countywide order that authorizes school nurses to do it. However, if they feel more comfortable working with a local clinic in their neighborhood, or if you as a physician feel more comfortable offering that testing for the teachers and the students, then obviously we don't want to impede that relationship either. And so, you know, we're really just trying to hear from all sides about how to get this done. So I just wanted to share that. This is the school waiver application. There's a whole page dedicated to the medical follow-up that might be needed for outbreak investigation and testing. And I just wanted to share that with you so that if you do hear about it from some other source, you can attest that you know heard about it from us at least once. Any questions about that? Okay, let me go to the next document, which is the COVID testing order. So you have seen a draft of this from last week. This draft has actually not changed that much. My team has looked at it multiple times at this point. We think that it's pretty much ready to go. And so I'm happy to share this out over email later after this meeting so that you can look at this draft. So again, this is still a draft. It hasn't been finalized, but I feel comfortable sending this out over email. And this basically will mandate that for ambulatory care clinics and primary care offices, COVID testing must be offered at least once per week for a 4-hour period, during which appointments or walk-in patients can be accommodated. And this can be done using self-administered nasal swabs, but it has to be done under medical supervision, which is kind of the standard of care right now. They don't want people to do home testing. And if you don't have the PPE to actually swab people yourself or have your medical staff swab people, then that's okay. You can just hand somebody the swab test kit and have them walk outside, take off their mask, swab themselves, put their mask back on, and walk back in and hand you that kit. That's how a lot of the testing is going on in some counties, and so that is an acceptable manner of having somebody get tested for COVID-19. We also have language in here about point of care testing. If you're using point of care testing, make sure you're using it correctly. Each of these antigen tests has a different time window for testing. For example, some antigen tests you can only test within the first 5 days of symptoms. There's other antigen tests where you can only test within the first 3 days of symptoms. And then there's some that are more sensitive and you can test for a number of days. And so in order to kind of cover all of those and any other point of care tests that come down the line, we just kind of made it a little bit vague. And we just said that, you know, antigen testing for patients can be performed instead of PCR only within the first few days. We didn't really give you a number. And due to the low antigen testing sensitivity, it should not be used after the first few days. And this timing can vary, so check with the manufacturer of the device. So hopefully that covers us, and it also covers you in order to to make sure that you're doing it properly. One big pitfall is if you're testing asymptomatic people with the antigen testing, then that may actually result in a negative in someone who actually does have COVID, but they're just not symptomatic. So that's kind of why we had to put that clause in there. We also have a whole page of FAQs. This is probably going to balloon to multiple pages. This won't be part of the order, but it's part of this document just to show you where we're going with this. And we have some of our physicians that are working with us, helping us create these FAQs. And if there's any other questions that you think we should include in here, then please suggest them. But basically, the FAQs will cover testing methods and labs, registration of patients, doing the test, contact tracing best practices, and what to do about COVID and influenza coming up on the winter months. So if you want, I mean, I can run through all of these questions really quickly, but like I said, if you have any other questions or something in the chat, please just interrupt me. I'm totally fine with that. But what I'll do is I'll just run through these questions. So for those of you that are on the phone, you can at least hear what these FAQs will cover. And if there's something major or minor that we haven't covered in these FAQs, please let us know. We want this to work for everyone. And obviously, as information changes, we'll try to update this. I want the FAQ piece of this to be a living document that we can go and answer questions as they come up and as new resources become available. So in terms of testing methods, which test methods will comply with this order? Pretty much antibody testing will not, but PCR testing for RNA and antigen testing will comply with this order. And that's just basically the state of the science right now. If that changes, then we'll change the answer to that one. Which labs can I reach out to? Well, we've actually done the hard work of reaching out to a bunch of labs on your behalf. And we basically asked them, can you support Fresno County physicians who want to do COVID testing? And if they said yes, then we've got them on a list. So we will actually share a nice table under this answer that says these are, a handful of labs that have attested to being able to support Fresno County physicians. There's one lab that's actually based here in Fresno County, which we feel will be ready by mid-October is what we're hoping. And so that's a lab where you can just send your swabs to a local lab that will run those swabs. Obviously, they have a limited capacity, so they won't be able to run everyone's. But if you can set up a contract with them, then that would be very helpful. Otherwise, even if you can't set up a contract with the local lab, most of the other labs are based in California, and they're offering a 24 to 48-hour turnaround time, which we think is pretty good. Will these labs provide supplies and courier services? Yes, for the most part, they will. Even if they don't provide the courier services, that's pretty easy to set up. You're probably already using courier services for some of the other labs that you're doing at your site. And in terms of supplies, yes, it's pretty much understood that all of the labs that we give a thumbs up to will provide supplies if you enter a contract with them. Will these labs bill insurance providers? In some cases they will, in other cases they won't. So you will have to just figure that out depending on which lab you work with. If they bill insurance providers, they may charge more, et cetera. You probably know the details better than I do about this. But in some cases they will. Otherwise, you will just have to bill insurance the way that you do with some of the other testing that you're doing already. What if my patient is not insured but symptomatic? That will be covered. I don't have the details right now, but that's one of the major kind of things with the CARES Act is that everyone who is symptomatic and who deserves to get a test will be covered. What if my patient is not insured but asymptomatic? So that one is a little bit more interesting. Some of those patients will be covered if they are considered close contacts. So if they're part of an outbreak investigation or considered close contacts or an essential worker, then they will be covered. If they don't meet those criteria, then it's going to be hard for them to get covered. But in that case, if they're asymptomatic, then maybe they should just be quarantining and not get tested. So there are some, criteria for asymptomatic patients who are not insured. But we can help you work through that. Like I said, the whole point of this FAQ is for us to really give you details as best as we know them and link to websites, et cetera, that can get you this information so that your medical staff can follow up on it. What if my patient is working at a school or workplace that has an outbreak and wants to be tested? So that's we think, a major type of inquiry that you will be getting, and we can help you work through that. But depending on exactly what's going on, they should be tested, and they should be covered under whatever coverage they have. And then obviously we also want to get good contact tracing established with them, which will be, that's I think the last clause of the order is to make sure that your staff knows how to do the contact tracing. And that's just right here, going back up. Healthcare facilities and medical providers must comply with reporting requirements, including positive results from point of care testing. So the 3 elements to be prioritized include reporting the positive result to the patient within 24 hours, initiating contact tracing using the templates and resources provided by the Fresno County Department of Public Health, and reporting positive cases to public health within 24 hours. And we're working on our end to make that as easy as we can, using some of the digital reporting that you're already familiar with, like CalReady and other tools. So we will make that, we're going to create a whole tip sheet about how to do the reporting for COVID, so that'll be ready by the time this order goes live. And we're still planning for a date of October 1st. Can I offer testing multiple days a week? Yeah, that would be fantastic if you can. The minimum is 1 day a week for 4 hours. But obviously, if you want to offer more and you feel like you have the bandwidth to do that, we would greatly appreciate it. And I think the patient community would as well. Registration of patients, how to do this accurately and quickly. So we'll try to give you some best practices about pre-registration, what is needed to register patients on site. We have experience with doing both of those with a lot of the pop-up testing that we're doing. And then can you offer drive-up or drive-through testing? Yes, you can. That's another way to do this. If that's something that you want to just set aside one afternoon or one morning a week and then just have a drive-up clinic that people can use, that would be fine as well. Doing the test, we'll explain how to do the test. So if you've never picked up a Q-tip and stuck it in someone's nose before, we will share the joy of doing this test with you. We'll have videos, we'll have some pictures and good resources that are available from the CDC and other websites about what PPE is needed and how people can actually do a self-swab safely. So all of that will be in the best practice tips section. And then contact tracing best practices. Hopefully you understand what contact tracing is. In some ways, it's just a really fancy way of saying taking a good medical history and a good social history. But there are obviously some elements of contact tracing that are more important than others, like if the person works, if the person has been around other people in a large congregate setting, et cetera, that we don't really focus on that much in the clinical setting, but they become really important whenever it comes to which social contacts do we need to follow up with to make sure that they have good information about their risk. So all of that is kind of developed into a questionnaire, which we actually send to patients and their relatives from public health, and we can actually share those resources with you so you can start to capture that information. As I've said many times before on our calls, contact tracing should start on the day somebody gets swabbed. So don't wait for the positive test. Actually try to capture this information. Just assume that they're positive and say, where have you been for the last 48 hours? Let's get all those details written down somewhere so that if you turn positive, we actually have all this information because memory is fleeting and people can get kind of squirrely. And so while you have them, while you're swabbing them, that's the best time to do the contact tracing questionnaire. And we can actually help you with that. It shouldn't take that much time, and it can be done by other clinical staff that are working with you. So you don't necessarily need to capture that information yourself. Can you bill for contact tracing? The short answer is yes. We'll show you how. That's something that CMS does want to support. So they have some mechanisms to allow for billing and following up related to contact tracing and other COVID education. Can my clinic staff capture this information? Yes. What information should a patient be told at the time of discharge? Pretty much just assume that it's positive. I mean, if you're bothering to swab them, I would just say, let's assume you're positive, go home and isolate until you hear from us that you're negative. And even in that case, we may give you follow-up instructions. But the last thing you want them to do is to get swabbed and then go to their uncle's barbecue right after that. Because that basically just, if that swab comes back positive and then they went and had a social gathering that afternoon, that actually complicates the contact tracing quite a bit. So basically, if they're worried enough to get swabbed, just have them go isolate and stay away from other people and avoid all non-essential gatherings so that they can basically minimize the number of social contacts that they're having while that test is pending. And what information should we relay to patients who test positive? Well, that's the most important piece of information, but that actually leads to a lot of other questions that patients may have. And we can help you find good information about where they can get resources, if they need time off from work, if they need places to stay in some cases, if they need other resources. There's actually a lot of agencies and community-based organizations that are working on that exact question. And we'll be able to hopefully share good information with you about where your patients can get help. And then COVID and influenza, this is something that, not being an infectious disease specialist, I'm pretty curious about myself, but we'll give you some good information that hopefully you can actually relate to patients, because I'm sure you're going to get this question if you haven't already. How does influenza differ from COVID and other wintertime viral illnesses? They have slightly different incubation periods, and there's a few other differences that we can incorporate into this FAQ. But just expect to do that kind of instruction all winter long. People are going to ask, I have the sniffles. Could it be influenza? Could it be COVID? What's the difference? How will we know? How could you test me for both? Et cetera, et cetera. The best thing we can do about influenza right now is really promote the vaccination. So really push that on your patients. Make sure your staff are vaccinated, which is now a health officer order for our county, and really get all of your patients. The CDC recommends anyone over age 6 months should get an influenza vaccine. So please make sure that you're helping to really prevent an influenza epidemic this winter by helping out with this influenza vaccine. So those are all the FAQ questions I could think of. I'm sure there's some that I'm missing. So let's just open up the call lines and see how everyone's feeling about this. Anything I'm missing? I'm trying to check the chat box to see if we have any. I saw Chris Staub was on.
Yeah, Dr. Vohra, hello.
Hi, Chris. I was just going to call on you. Go ahead. I want you to remind us
thank you.
about the good work you're doing and ways that we can all support you.
Thank you. Before I talk about that, I wanted to ask you a question about the vaccine, the influenza vaccine. So we had an arrangement with Community Care Health Partners, our health insurance for our employees, and they came in and provided vaccine for our employees. For blood centers, are we required by the county to have our employees all vaccinated? Is that what I heard?
Yeah, that's something that every year we do sign a flu order, which mandates that all clinical healthcare workers get, well, really all healthcare workers get a flu vaccination. So, from my understanding, I would interpret that as saying, yeah, I would require it for your staff.
Okay, thank you.
Sure.
Thank you for letting me have the mic. I wanted to just point out to everyone that our whole country and also our region are in the midst of one of the most critical blood shortages in decades. And this is because of the pandemic, which beginning back in March led to school closures and therefore school blood drive closures. And we have been unable to have significant blood mobile collections since March. And so we've had to get along with other tactics of trying our best to drive, not drive physically, but to direct donors to come to our fixed sites. And historically, we got half of the blood we collected from mobiles and half from donors coming to our sites. And we have now, we meaning all the blood centers in the country, have been forced to try to get more like 80% coming to the fixed sites, and we're lucky if we get 20% of our need from remaining mobile drives that we have. But we are emphasizing that all of our collections facilities and sites are COVID safe. in a sense that we observe very distant spacing of our people and chairs and things like that. Universal masking, as well as temperature taking when anyone comes into our facilities or into our mobiles. And so we're asking, and I know Dr. Vohra, you were kind enough to write a letter that we were able to circulate to our historic blood drive sponsors, asking them please not to cancel blood drives, and that we do conduct safe blood drives, and that the blood supply is in critical condition right now. The number of, the demand for red blood cells and platelets hasn't really been down that much. In fact, right now we're sort of back to pre-COVID levels as far as demand for red cells and platelets. So with the collections off by 20 to 25% and the demand not abating, we really ask all the care providers, hospitals, community groups to please consider hosting your blood drives. Please don't cancel them. And also, if you haven't hosted any, please talk to us and we'd be happy to have you host a blood drive. Thank you, Dr. Vohra, for the county sponsoring a blood drive coming up very soon downtown, and we appreciate that. So that's the main thing. We're very short of blood. Please encourage healthy people to come out and donate blood. It's safe and it's essential for the community.
And it sounds like you have mobile units, right? That can be mobilized and yes. Set up, because we're really pushing for the fairgrounds to offer that during the Big Fresno Fair, and I hope that works out.
Yeah, Ursilia Lacaze, our director of marketing, is probably on the call today too, and she was able to work out with the Fresno Fair how we're going to sort of co-promote each other and hopefully drive some blood donors to our fixed sites.
Okay.
Thanks, Dr. Vohra, and all your staff.
Sure. Thank you, Chris. All right, we've got some chat questions here, so I'll just try to go through some of these. Can you share where the contact tracing templates and questionnaire is located on the county website, please? Yeah, I can try to do that. I don't know if it's really posted on the website, but we do have internal documents, so I can be sure to share those out. Yeah, so we'll follow up with that. The questionnaire itself is actually part of a portal, and what we've had some success with doing is actually getting patients to fill it out through email or text message, so we can continue that if that's how you want to do it, or if you want to just incorporate all those questions into, say, Epic, for example, or some other system like that, then we can just share all the questions, and then you can kind of build it the way that you want. So the contact tracing templates, yeah, I mean, it won't look much different from what we're already using. We just want to capture that information earlier. So we're asking everyone's help in getting that information the day that they get swabbed. And then the next question is, antigen testing is giving a false positive. And if it's not good for asymptomatic, why is it being pushed for screening asymptomatic employees? Yeah, good question. I don't know that it is being used for asymptomatic employees. I think I haven't seen how the SNFs are using it. I know that they are getting those machines. So that is a very valid concern, that you can get false positives and false negatives. I think in cases where the person is asymptomatic, or there's a very high concern for COVID despite a negative test, you may have to do a follow-up PCR test just to confirm. And that basically will hopefully take care of the false positive, false negative. I mean, the appeal of doing the antigen test is, in a clinical case that sure looks very symptomatic, you can get the answer in like 15 to 20 minutes. And that may be worth it and offset the other issues related to antigen testing. I'll be honest, I don't have that much experience with antigen testing. We don't use it currently with any of the stuff that we're doing at the county level. So we're still waiting to see how these antigen tests are going to get unrolled. And I think some of you out there are probably more experienced with the antigen testing even more than we are. But we'll try to find out the answer to that. And hopefully everyone will understand the operating characteristics of these antigen tests so that they understand when you can use them and when you should not use them. From what I understand, a symptomatic patient within the first few days, that's the best use of an antigen test. An asymptomatic patient or a long time after they've been symptomatic, it's not appropriate to use the antigen test during those times. And I don't know if Dr. Al or somebody else on this call wants to expand on that. Could you clarify contact tracing requirements for hospitals? With the volume of COVID we are seeing in our busy ERs, this would be a huge impact. Yeah, so we can certainly try. Like I said, contact tracing really is just capturing a good social and work site history. And we'll try to clarify what that looks like. When you say hospitals, I mean, the ER is a little bit different than the inpatient side, just in terms of length of stay, et cetera. So we may have to craft different guidance for those. But from what we understand is, if someone is getting tested in the ER, then they should still capture some basics of contact tracing on the day that they get that test. It won't be a huge long form, but it is something that's worth capturing at the time. And in fact, when I'm working my shifts in the ER, it's something that I'm able to incorporate into my notes as just, this person works here, they've been to these gatherings or they haven't been to any gatherings, and here's the number of people in their household. And that's basically the elements of contact tracing right there, so that if they do come back positive, whenever we follow up on that information, at least that's captured. Obviously, whenever we call the person, we do a more in-depth questionnaire with them on that day, but sometimes we don't get a chance to call that person, so it's best to really capture that information earlier rather than later. The reason it's important to do a good in-depth contact tracing for hospitalized patients is that we really want to make sure that there's no hospital spread for that patient, and that might mean doing some more in-depth contact tracing while that person is hospitalized to make sure. So hopefully that makes sense. I don't know if I answered all of the implications of your question, but we're happy to help out. If you have any other questions, just find us offline. And then Dr. Linscheid shares that there's a link on Public Health to sign up for CalReady, and it goes through some of the contact tracing. So yeah, thank you so much, Dr. Linscheid, who is working in primary care, but also helping us at Public Health here. So we're really glad that she's advising and guiding some of the development of this order, because it's really nice to hear from someone who's on the front lines of primary care that is advising about this. But there is a portal. Actually, I don't know if you're listening in, Robin, or if you want to talk about this, that people can access to do the provider reporting. And I'll just share my screen again if that's helpful. So this is the Fresno County website, and this is the Health Messages for Medical Providers tab, which you can find from the main tab. It's just on the, if you just scroll down, it is, oh, where is it? Now I lost it. Sorry. I'll try to find it.
Dr. Vohra, it's to the left, second to the last one on the bottom.
Oh, there you go. Thank you so much. I appreciate that. And basically reporting a case, this page walks you through how to do that. And providers are required to report all laboratory confirmed cases. And this is a letter that we developed to help you walk you through that. And here's a video that our EPI team created to help share how to do this. So please look through this, because this is the best process. This actually helps everyone if you're able to do this online reporting form. And so that's what we're asking everyone to sign up to do.
And Dr. Vohra, I'm on here, but yeah, thanks for going through that. And at our office, we just had our office manager do this, so it can be done by an MA, staff person very easily, and then funnel all of those tests through that, so that it's not an added burden on our documentation and schedule in our daily clinic.
Oh, great. and we're ready to help anyone else on this call, get started with this. I know it can be daunting to have a different portal to have to log into, et cetera. But we've really tried to create as many resources as possible to help you. And we're happy to set up a Zoom meeting to help you and your staff learn how to do this. Maybe next week we can set aside time to actually dive deeper into this. So please take a look at this, and we'll set aside some time next week to dive deeper into the actual reporting portal so that everyone is on the same page about how to do that. Okay, a few more questions here. I mentioned that elementary school is being able to file for opening. What criteria needs to be met for middle schools and high schools to open? Great question. So for the K through 6, we're granting waivers to open those right now while we're in the purple tier. For the other grades, we have to wait till we're in the red tier for at least 2 weeks. So that's kind of why our trends matter, is because once we switch over into the red tier, then we'll be able to open those grades after 2 weeks. Where would we find our local current positivity rate? Well, that's a great question. The CDPH website actually has that information. The positivity rate that we report is on the dashboard, but it's for the entire pandemic. And that's absolutely correct. The positivity rate that the state's using is actually over the last 7 days. So they actually have a better positivity rate, because if you look on our dashboard, the positivity rate there is accurate, but we're just looking at a larger time frame, which is ever since we started doing the testing back in March. The positivity rate that the state's using to move people across the colored tiers is actually something that they're reporting and calculating based on the last 7 days of results. We mentioned, okay, so we answered that one. And Rick says, happy to review the school waiver. Thank you. Yes, no, we got that. And I will reach out to you, Rick, to look at the school waiver guidance as well. So thank you so much for everything that you're doing, and we appreciate your feedback on that.
Thanks, Dr. Vohra. My pleasure.
Rick had a good question. What about surgical subspecialty clinics? Are they held to this mandate to test for COVID? Well, not through this mandate. You may have some other sort of standard of care issues related to surgical patients where you may need to test for COVID or at least screen for them, but that's not covered by this mandate. Really, the operational question here is: Did you test for influenza last year? If you tested for influenza last year, then you will be expected, not only by us but by your patients, to test for COVID this year. So that's kind of the, that's the operational question, is did patients come to you expecting an influenza test last year? Because if they did, then you can expect that they will come to you expecting influenza and COVID testing this year. And so hopefully that answers that question about which actual practices and specialties are covered by this. But if that's not clear, then please reach out to us and we can help clarify.
Thanks, Dr. Vohra. This is Rick. Yeah, the difference for us here at SPOC is because we are multi-specialty. So we have primary care, we have orthopedics, and we have orthopedic urgent care. So gotcha. we are going to offer COVID testing,
okay,
at least once a week, if not twice a week, to our employees and our patients.
Great.
For sure.
Okay.
We probably won't be able to do walk-up unless it's walk-up through their, because our urgent care is orthopedic only.
Okay, right.
So.
But will you be able to have like a pre-registration so you could do like a next day test for people?
Absolutely. Yeah, we plan on having that. And we also plan on having a point of care testing available as well.
Great.
And we use Quest and we have a great relationship with Quest. And then of course, we're screening, through Vera Health and through that mobile platform. So
great.
We've got all that.
Okay.
Which we rolled out to patients, by the way.
Oh, that's great. That's great to hear.
Yeah, we have 5,000 users being screened before they come in.
That's great. Let me quickly try to find this the positivity rate if I can. Whenever I try to drive and do Google, it never goes well.
Dr. Vohra, this is Dr. Lynchide. I just posted a link to it. It's under the blueprint for California. I posted it in the chat.
Oh, thank you.
And then you can just click on the individual county, and then if you click on Fresno County, it'll give you the current positivity rate.
Yeah, so you can actually hover over and I'll just share. So it's just Blueprint for a Safer Economy, California. So, and it basically defines all the levels for us right at the beginning. And we're in the purple, like I said, but we're hopefully going to move into the red if our trends keep looking as good as they do. And this is the map that Dr. Lynchide was talking about. So when you hover over Fresno County, this basically tells us, what the rate is, which right now our positivity rate is 6.2, and then our cases per day are 7.5. You can sort of see that they've got two numbers there, 7.8 and 7.5. And that's kind of interesting. The state is taking it upon themselves to do more statistical acrobatics than was required. And they basically are doing these adjustments based on how many tests each county is doing. So they basically said, if you're doing more than the state average, which is about 233 per 100,000 people, if you're doing more than the state average, then they will give you extra credit and they will actually reduce your case rate. If you're doing less than the state average, then they will dock you and they will actually inflate your case rate. So no one's really happy about that, but because for the first 2 weeks they inflated our case rate just by a little bit. But now that we're above that number, at least for now, they basically knocked down our case rate from 7.8 to 7.5. It still didn't get us below 7, which is where we need to go for red, but you could sort of see that's how the adjusted case rate happens. And they're doing other kind of statistical acrobatics related to, they basically want to do some correction for health equity. And it's complicated to explain, and it's not really been rolled out yet. But they basically want to make sure that the very top quartile and the very bottom quartile are not very far apart in terms of, I think, household income or some other equity data that they're using. And again, they're still trying to figure out how to make this work, but they are going to have an equity metric that they're using along with this tiered system. It's just not currently part of this system. All right, any other questions or comments? Okay, well, I think we will go ahead and end there. I'll just check the chat one more time. Okay, so good question about a recent health order. It says your new health advisory regarding congregate settings does not state that nursing homes receiving patients from hospitals do not need to require testing for patients that were in the hospital for non-COVID related symptoms. Are we able to include this in our health advisory? Let me see if I understand that. Sorry, I'm just not, I don't know if I quite understand the question, but I'll try to find, if I can track you down, Julie, offline, we can talk about that one. This was really just to be able to clear people without having to do clearance testing. So we really thought of this last advisory related to congregate settings as an expansion for an earlier advisory that we did related to clearance testing for work. So in the same way that we said clearance testing for work is something that should be abandoned, we really think clearance testing for congregate settings should also be abandoned under the same principle, which is that symptomatic clearance makes much more sense, and it's just easier for everyone involved. So that's kind of the rationale for why we released this latest advisory. The first one was clearance testing for work, and this last advisory was clearance testing based on the same principles for congregate settings. So I don't know if that helps clarify that issue. Oh yeah, go ahead.
This is Julie.
Oh,
So
hi,
last
Julie.
at your last meeting, you had touched on this some. What we're experiencing is we're a surgical hospital, and we're discharging our patients to the nursing homes, and they're requiring that they get tested prior to the nursing homes receiving them back when they weren't seen in our hospital for anything related to COVID. And so it was my understanding that in the health advisory that you were going to be doing, which you have done, that you were going to say that it wasn't necessary for the nursing homes to require this from people that are in the hospital, especially if they weren't in the hospital for COVID.
I see. Yeah, that wasn't really the intent of our advisory. So I mean, that's a good question and a fair question. The advisory that we crafted was really for COVID patients. And once they get COVID, then you wait 10 days or in some cases 20 days, and then you clear them based on symptoms. So that was the whole point of our advisory, was
Right.
COVID patients and that we shouldn't do clearance testing on COVID patients.
Okay.
So for what you're asking for patients for non-COVID patients, our advisory doesn't really speak to that, and it wasn't intended to.
So then the nursing home should continue to require testing for patients being discharged from a hospital regardless.
Yeah, I mean, it depends on what their situation is. You know, a lot of nursing homes can now do testing, and they're going to have the resource to do that. Or they can accommodate patients that, you know, are under suspicion for COVID in like a warm zone. So they should have some, you know, some ways to kind of mitigate introducing COVID into their setting, which is obviously something that they are concerned about. Whether they require testing or not, I mean, it's hard to make a blanket statement because every hospital like yours and other hospitals have slightly different resources, and so it's really hard for us to adjudicate whether it should be required in all patients or not. But we're happy to help you work through a policy that makes sense, especially if you're a surgical hospital that's treating patients for non-COVID related symptoms or conditions. Then we can help you, you know, work through a policy for that.
Okay, thank you.
Sure. And then the last question is, does this advisory cover assisted living, independent living, board and care, and room and board? Yeah, you know, I didn't explicitly use those terms, but we use the term congregate setting to cover all of those. So I don't know if that's enough to satisfy what you were asking, Pamela, but please reach out to us if it's not clear. But we just use the term congregate settings to mean all of those settings. And it's the next question is, has CLC been provided this health advisory? Well, I mean, it's posted on our website. Sorry, I don't know what CLC stands for, but I'm happy to share it out if you want to email us. But it's on our website under the Healthcare Professionals tab. Right down here. September 11th. All right. Well, thank you all. I appreciate the conversation and the feedback. I hope that we were able to clarify most, if not all, of your questions. If there's any outstanding issues or anything, please let us know, and we'll see you again next week. Thank you.